On the big story on what we're going to be debating this evening, this is in an effort to bridge the doctor-patient gap in rural areas of Maharashtra. The state cabinet having approved a decision for introducing quota in medical post-graduation seats. The quota bill, which is yet to be tabled in the assembly though, but it has proposed 10% reservation for MBBS and 20% reservation for postgraduate who are willing to work in rural areas for 5 to 7 years respectively. It would have some strict conditions here that have been listed as well. For instance, those who fail to work in government hospitals, rural areas after their degree could even face a jail term of up to 5 years or have their medical degree cancelled altogether. Let's in fact get in our correspondent Neha getting us those inputs here. Neha, this is of course with respect to young medical students start of the training to be serving in the rural area first and for a large duration of about 5 to 7 years, and if not facing strict penalty in that case. Can you get us some reactions from young medical students on how they're looking at this development?
Absolutely, Seher, and which is why when we say that this is to bridge the gap and this is to get the doctors trained, the future doctors, to ensure that the rural healthcare sector of Maharashtra is helped by these doctors, it definitely comes as a good move, because we'll definitely be seeing good doctors being trained here, go there and serve people, patients. We definitely know that many hospitals, state-run hospitals in the interior areas of Maharashtra are still bereft of doctor capacity. They run on a very strict schedule. They have a limited staff, and at this time this move definitely comes helpful. It will be a good step, but the kind of restrictions it is imposing or the kind of penalty it comes with surely comes as a worrying factor for the doctors here. The time period that has been brought for them, the 5 and the 7 years, many doctors who we spoke to said that this is too much of a time, and the fact that to have dedicate so much time there after having done education, after having done an internship, will be too much of an experience. And at the same time, the penalty that is imposed, that is also something that they have not liked, because it also brings a 5 year of imprisonment, and along with them their licenses will be cancelled if they do not work in that period. So this is something that is obviously been raised objections from as far as the doctor community is concerned. In fact, just to give you a direct view from a medical student himself, he is the state president of Indian Medical Association Maharashtra. Doctor, tell us what is it that is good about the move, and the kind of penalty that has been imposed. What do you have to say about that?
As the state president for Indian Medical Association Medical Students Network, we surely welcome the move. But the problem we see here is that the penalties that are imposed here are counterproductive for the move. A doctor will not opt for anything at which he's at a risk of losing his degree or he's at a risk of going to jail. So we believe that the penalties for the violations are counterproductive. Secondly, we welcome the move totally because in a country like ours, with a population like ours, with one doctor catering to 1,400 people, even lesser in the rural sector, we surely do need doctors, but we also have to keep this in mind, that a doctor will only go to such a place after toiling for 5+ years, when he's ensured basic facilities, a strict work time, and his own safety. So I think this move needs to be reviewed up to some extent, where we can have a middle ground where the doctors will also be eager to go for such a rural posting. Apart from that, a rural posting for 5 years and a 10% quota, to be logically speaking on a medical student's perspective, I would rather spend 2 or 3 years more giving a repeated attempt for the NEET PG exam rather than spending 5 years and ensuring only a 10% quota. So a reduced amount of time to about 2 to 3 years of the posting, better health facilities, better facilities for the doctor, better pay, lesser working hours is what we would need, and review the violations and the punishments for the violations.
Absolutely, sir. And just to add a minor point, that many doctors
all right, so undoubtedly this is something that would need to work here as an incentive for the youngsters as well. Neha, stay on with us. We're getting in more voices. Dr. Suhas Pingle of the IMA in Maharashtra. Dr. Pingle, thank you for being with us. Are you in agreement with what the state government here has proposed? Now, rural postings is something that has been followed by several other states, has been followed in Maharashtra as well. but to come up with a formula which is so strict in its conditions that there could be jail term if you don't give in 5 to 7 years, your entire degree could be taken back. Should this come with these nature of strict conditions?
This amounts to putting a tag of criminality on the behavior of the doctors. Hello?
Mm-hmm.
This is putting a
Yes, we
criminality
got you
tag
there.
for
Please go ahead.
doctors for act of omission, which is too much. In this country, people have gone having murders and then they have got away. So this is not acceptable to us. Tag of criminality should be removed.
Right. Dr. Pingle, do you think that this is also over and above in what the Supreme Court has stated in supporting compulsory rural service after having attained your medical degree here? It is mandatory as per the Supreme Court. It needs to be 2 to 5 years. You submit a bond of about 20 to 50 lakh rupees. Now, these are conditions that have already been specified by the Supreme Court. Why do you think that the state government of Maharashtra should be further adding more restrictions on that to increase that to 7 years,
No, that
or
is
to
up
make
to
it
that is up to the government. That is
right.
up to the government to answer why they have added these strict conditions. But as they have also offered
Right,
the
but no,
PG
Dr.
seat.
Pingle, I'm asking you this. Has there been an observation that compulsory rural service is not being followed, which is why the government felt that this needs to be upgraded to further strict conditions? That's why I asked you that.
No, we don't approve of this. Hello?
Dr. Bingley, in what sense do you think that the government would need to revisit this proposal?
No, government, as they say, there is a policy of using stick and carrot. Now, you are using only strict measures, that is stick. What in return the students are being offered? We are free citizens of this country. Just because we take up the medical education, do you mean to say that we are equal to criminals?
Right, Dr. Pingle, we get your point. Let's also get in Dr. Abhay Shukla with us on the phone line here as well. Dr. Shukla, in your view, what should be the incentives provided by the government to make this more attractive for young medical students, for young doctors here, to be serving time in rural service up to 7 years, between 5 to 7 years?
Yeah. So, on the whole, I think the intent behind this decision is positive, in the sense that the Maharashtra government has at least acknowledged that there is a serious, need for ensuring doctors in rural areas, and in a sense that is reflected in this decision. However, there are, a couple of issues which we need to keep in mind. First of all, the bond which was there until now, the compulsory service bond for both MBBS students and PG students, that has not worked, and there doesn't seem to be much analysis about why that earlier or existing bond system has not worked. That is something which actually should have been analyzed, and the experience is that a purely monetary bond is not a very effective way of ensuring that doctors serve in rural areas. Most doctors have large numbers of doctors have.
Okay, but doctor, do you think that a 5-year jail term, that a 5-year jail term to entirely criminalize this if you're not serving time in rural service of 5 to 7 years, can that work on ground?
That is not justified. We would not support this imprisonment clause because that is not appropriate at all. But what the Maharashtra government also needs to do is to make the work more attractive, you see. So working conditions, living conditions for the doctors in rural areas, education of children. For example, Chhattisgarh had this rural medical corps, in which doctors who are working in difficult rural areas were given a whole range of special incentives. And, which made it possible, for example, for the doctor to maintain a second establishment in a larger city, for the children or the, family to stay and get education. transport facilities, communication facilities,
Okay.
and also good working conditions, adequate medicines, equipment, quarters, well-constructed quarters, etc., etc. So the government also needs to put in those kind of investments to make the rural services attractive to doctors. And, the parallel example is of the army, where you have a short service commission, where the army actually pays for practically the entire medical education of the medical student, and then the student has to, depending on short or long service commission, has to serve for either 5 years or 20 years with the army. So the thing is that you make this person
Okay.
a part
So
of
you
your
think
system
what the government here, specifically the Maharashtra government here has proposed is lacking in incentives? Yes, Dr. Shukla, please stay on with us. We appreciate those observations that you've listed out here. Let's also get in more voices. Dr. Ravindra Kute, who's of the health infrastructure, works in rural Ahmednagar. Thank you for being with us, Dr. Ravindra. In your view, to what extent is this proposal going to work on ground, work as a positive in making it equally attractive for young doctors to serve a time of 5 to 7 years in rural areas?
Hello. Hello.
Yes, we can hear you.
Yeah. Am I audible to you, madam? Hello.
Yes, please go ahead, Doctor. Dr. Ravindra Kute, please go ahead.
This is Dr. Ravindra Kute from Srirampur, Ahmednagar. And I have got an established setup in a rural area, working for almost 25 years in rural setup. The working in rural is really, it's lovable, provided there are good working conditions around you. I know most of the places in Ahmednagar district also, the tribal areas, where there are no good working conditions. Hello, madam. Hello.
Yes, we're getting your point here. Dr. Ravindra, what you're saying is that what young doctors should be assured is that there are basic facilities, there are good working conditions available, and offering which young doctors would be only too glad to be serving time here, to be providing their services, which could range from 5 to 7 years. You think that the Maharashtra government has missed listing out those incentives in this proposal?
Yeah, this the decision taken by the government that some reservations for the doctors working in the rural sector is a good decision. It should be welcome. I am also working in the rural setup for last 25 years. But there are certain lacunae that present.
Yes.
Number one, people from rural sector, they are lacking the basic facilities and even the basic medical services. The consultant services are far away. Most places, they don't have doctors or paramedics in 8 to 10 kilometer distance. If doctors go there, they should have a good infrastructure available. Transportation is a big problem in rural area. In most of the villages, there is no bus services available. And the people, they have to come by walking or by some other bicycles, or sometimes on the use some animal carts and all this. Education facilities for the children, they are also lacking in most of the villages. Then, as far as the safety is concerned, work safety, that is also not there. And natural calamities, in the rainy season, almost the villages are disconnected from the other villages. There are heavy rains, there are floods, they are attacking wild animals also. So the living standards should be improved. Then there are no nearby government offices. And even the post, telegram, and the police stations are also far away from the villages. Modern electronic gadgets, most of the time there's no internet, no
all right. So, Dr. Ravindra, in what you've listed out here from your experience in serving in rural areas here, that the government
Yes.
instead should be focusing on upgradation of infrastructure in these areas, health infrastructure, other issues that doctors would face if they're spending time in the rural area and serving people in the rural area. You think that the government should instead be working on health infrastructure upgradation instead of introducing this proposal, which has a criminal liability as well, that the doctor could be sent to 5 years imprisonment if you refuse to serve in rural areas.
That sort of punishment, heavy punishment should not be there. Rigorous punishment should not be there. There should be some flexibility must be there. Otherwise, if the proper infrastructure is available, the doctors will love to work, because any doctor he wants work.
Absolutely. Yes, please stay with us. Let's also get in Dr. Prakash Bagode with us. He's the Joint Director of the DMER. Dr. Prakash, thank you for being with us. Did you feel that the government's approach here should have been on focusing on upgrading health infrastructure in rural areas instead?
Obviously, it is a government's desire to improve the health structure in the rural areas as well.
Okay, we seem to have lost that line. Let's go across to our correspondent Neha Kulkarni, who's of course getting us some young voices here. Neha, we've spoken to several experienced doctors here, saying that the intent of young doctors should not be questioned. Instead, what the government should also offer as incentives, as making this more attractive, and these are just the basics that the doctors would need in basic facilities, infrastructure upgradation, safety issues that one would face in the interiors.
In fact, Seher, the point is, when we spoke to the doctors, what they say is that as far as remuneration is concerned, when they have to go to the interior areas and work, that is not an issue, because the state government assures that if you all are going to the interior areas and if you are working for a long period of time, there is enough remuneration given, there is an enough salary package that is promised to the doctors, which is at par or even above as to what resident doctors in the city area or municipal areas must be getting. But it is the safety and it is the other things that they are concerned about, because that they have to dedicate so many number of years there, and second, whether there are even facilities out there for the doctors to even work. So if there are there is no proper medicine facility available, or there is no infrastructure there, how are the doctors supposed to work? Is what the point was raised here by Dr. Mehta. Is that right, that you all are questioning the fact that whether there will be even that many facilities available in the rural hospital for you all to even give that much care to patients, right?
So apart from the facilities given in the rural hospital, there will be a lot of workload which will be expected from us, which may not be in our hands at times. Safety of a doctor is one burning issue which we always need to consider. And being in a rural area which might not be that accessible, it can get really dangerous for a doctor. Apart from that, basic necessities for a doctor as water, clean water, electricity has to be guaranteed to a doctor, because burning the midnight's oil is just as a good proverb, and we need electricity to study anyways. Eventually, we will all be studying for our PG entrance exams, to fly abroad, or to continue as a practicing general practitioner. And these basic facilities like mobile network, electricity is something which we would always require, and which would attract more doctors to go. Today, if you ask a doctor, he would not be sure, because these facilities are not guaranteed to a doctor as of now.
But Dr. Mehta, one more point. Now that this quota is introduced, does it kind of reduce the number of seats for you all? Because we've already seen a spar about how the quota system has been exploited. We had seen doctors coming on the streets protesting about the quota system being given. So does it, if you don't have to opt for this service where you have to go to the rural sector, does it reduce the number of seats for you all?
I'm not sure. They have said that 10% of seats would be reserved. But how is that 10% taken out of the whole chunk of the pie is not something that we are sure of. It may be from the reserved category, open category, or a balanced of it. But we're still not sure how will it be implemented. Apart from that, EWS or the economic weaker section, where our Prime Minister guaranteed that if we are introducing a quota, we'll increase the number of seats. A similar promise or a similar clarification for this quota which would be introduced has to be given as well.
So, sir, obviously, not that the quota system has not been debated before, but here the doctors are also asking about the benefits and facilities they'll receive if they make this choice of going in the interior areas of Maharashtra to work as a medical professional.
Okay. That's right. But Neha, the conditions that were put across and what the Supreme Court had supported as well, because there are other state governments who've implemented here as well, compulsory work in rural areas. Other young doctors have been doing that for so many years. The fact that a submission of a 20 to 50 lakh bonds, that condition has not worked in the past, which is why the Maharashtra government has put in even stricter conditions that if you don't, you will have to serve jail term of a maximum of 5 years. The reason why this has been made stricter by the Maharashtra government, because the earlier conditions have not worked.
Absolutely, sir. That is right. But if we have to reiterate what Dr. Pingle from IMA has to say, this is like imposing criminality upon doctors who are actually pursuing education and living up to this.
Right.
While we agree that they are supposed to complete the term of 5 years and 7 years, the more stricter the punishment is made, definitely that will deter away more doctors from even taking this choice. So how is it going to encourage the entire system and bridge the gap between the number of doctors that are required to be working in the interior areas? Is a question that the government should answer.
Absolutely. Neha, thank you for getting us those young voices. We appreciate other doctors who've spoken to us here on this as well. The consensus on this seems that doctors willing to work in rural areas, but with certain incentives, not just incentives, but just an insurance here that as far as the basic facilities are available, as far as the basic infrastructure is available, safety issues are taken into account, and not to look at doctors as criminals. If they're not willing to serve, do not add the clause of criminality and making this as a case of serving jail term for 5 years. That is unfair, that is unfortunate, but specifically in this case that the Maharashtra state government now in this proposal would need to revisit. Thank you for being with us.